the Bone and Joint Health Network from St. Joseph's Memorial Hospital. We have Jessica Kerger, who is the nurse navigator, Janelle Coleman-Smith, who is our outpatient health navigator, Michael Johnston, a licensed acupuncturist, Empire specializing in chronic pain, and Steve Reis, is that right? Excuse me, personal trainer and owner of Santa Rosa Strength, specializing in helping those with arthritis or spine issues. So Jessica, I think, is going to speak first.
Thank you, Sheila. All right. So my name is Jessica Kerger. Sheila introduced. I'm very happy to be here today, so thank you all. I hope you can hear me okay. If I need to put this closer, just holler at me. To tell you a little bit about myself, I work for the Center for Bone and Joint Health at Santa Rosa Memorial Hospital. My specific title is the nurse navigator for the joint program, so I navigate total joint replacement patients. I teach the preoperative surgery classes and a discharge class and navigate them through the whole process. So that's just a little bit of a background of myself. Today during this presentation, we're going to talk about healthy joints, healthy spine, back, and you, and maybe your patient population, for those of you that work in healthcare, which is a lot of us here. So I'm going to go ahead and start with a trivia question, and Janelle will be handing out a couple of prizes to those who get close answer. So it's just a fun little fact about bones, and I'm going to hand out 2 prizes for those who are closest to the answer or those who get the answer. So my question is, does anyone out there know how many bones are in the adult human spine, or the adult human body, excuse me?
206. 206.
All right. Is that 1?
206.
All right. That's right. Yay! There you go. Well, a lot more people knew that answer to that question than I thought. Well, we have plenty of t-shirts, so. So, yeah, I always think that's a fun fact to start my presentations. I start my joint class with that one. So what can go wrong with all of those bones and joints in the body? I'm going to talk a little bit about this and arthritis. So arthritis is one of the most prominent diseases worldwide. Most of you probably know that. You probably have family members, friends, maybe you, and patients that suffer from arthritis. Up here I have a photo of a healthy hip joint on your left and an arthritic hip joint on your right. So you can get an idea in a picture of what an arthritic hip joint looks like. On the left, you can see this nice pink area. That's your cartilage that allows your hip joint to move nice and smoothly without any pain or stiffness. And then when someone has arthritis, on the right, you can see that that articular cartilage is worn away. So what is arthritis? Arthritis is inflammation of the joint, most commonly in knees, hips, and shoulders. Can be other places in the body, but that's most commonly where we see it in healthcare. There are many different forms of arthritis. The most common that I see in the hospital is osteoarthritis, rheumatoid arthritis, and traumatic arthritis from previous injuries or something like that. Other indicators and things that happen with arthritis is cartilage being worn away. So like the photo we saw before, your cartilage breaks down, and it can sometimes lead to being bone on bone, which can be extremely painful and have loss of, for people who have arthritis, they have a difficulty with quality of life, maybe not being able to do the things that they want to do every day, and things like that. I'm going to talk a little bit about spine health now as well. Another fun fact that I like to share with individuals is, well, first let me ask you this. Who out there has suffered from a back injury or knows someone who has? Probably all of us. It's a lot. So this fact I like to share is over 42 million people go see doctors every single year due to a back injury. That's a really high number. These back injuries can be anywhere from a spinal fracture to a pulled muscle to a strained muscle, anything like that. So just to kind of wrap up my portion here, if any of you or anyone that you know, family, friends, patients, probably a lot of the elderly population that we may take care of these days suffers from arthritis, there are many options available to help with that and to help manage pain. So not just joint replacement. There are options from losing weight to exercising regularly, low impact exercise, and then other alternative options as well. So I will now introduce Janelle Coleman-Smith. She is our outpatient navigator for the Bone and Joint Health Network Network, and she's going to talk to you a little bit about the Bone and Joint Health Network and different options for those who suffer from arthritis or just pain in general.
Thank you, Jessica. So I'm Janelle. I've been a nurse for 9 years, working in orthopedics. Thanks for having the Bone and Joint Health Network here today. So I just want to tell you a little bit about our network and navigation and our vision. So we are developing a new paradigm of practice within our hospital. We collaborate with practitioners and to optimize our community's health and wellness. We have an integrated network of partners and other resources to allow our clients to choose what will motivate them to help them reach their personal goals. As Helen Keller once said, alone we can do so little, but together we can do so much. Navigation is the key to connecting these resources and services for both our clients and the community. As you all know, we have many hospitals within our Sonoma County, and acute care in Western medicine can be miraculous and life-saving, but when it comes down to it, a lot of these people have these long-term chronic illnesses that they're facing. And so they're living with arthritis, and these conditions are not always dealt with on a long-term basis. Having worked in healthcare for a total of 17 years, because before I was a nurse, I was also working in healthcare, I have seen how important it is to access and utilize community-based care, especially with these chronic conditions. Community is critical in maintaining and obtaining better quality of life for these people. So the boomeritis age. So our beloved baby boomers are getting older. Can anyone guess how many people will be baby boomers by the year 2029? It's a lot.
54 million.
How many?
54 million.
So I think the 54 million is the closest. So it was 71.4 million people will be 65 or older in 2029.
Nice.
Yeah, that's 20% of the population. So this generation had a lot of influence, and they, created their own they reshaped societal norms. So now as they face issues such as arthritis, they make it clear that they are not willing to give up their lifestyle. They want to utilize multiple modalities of treatment to remain active and to maintain their well-being. So the bone and joint health management process, this is kind of a referral process that we use. We receive most of our incoming referrals from orthopedic surgeons and also primary care physicians. We get patients that may not be ideal candidates for surgery due to chronic illness, such as like uncontrolled diabetes, morbid obesity. And because the surgical outcomes of these patients is not going to be ideal. They're going to have a lot of complications. So we help these patients learn ways to manage some of their issues by directing them to community resources. We work closely with many other health and wellness providers, such as clinics, gyms, weight loss practitioners, physical therapists, complementary therapists, such as acupuncturists, nutritionists, anything that the patient thinks that they're going to need to help them get to their personal goals. So we hope to continue to grow this health management process, and we hope to continue to get referrals from the community as well, and from our partners, and still from the physicians. So why should community-based programs partner with the Bone and Joint Health Network? So my husband gave me this, I hope it works. Oh wait, sorry, yeah, there we go. So I'm just going to read off this slide basically. So we do a lot of staff education, we have free partnership marketing, we host community seminars, we stick with the motto, buy local, stay local. All of our partners are local currently. And we develop relationships with the physicians. Our areas of focus are weight management, diabetes management, pain management, and psychosocial management, amongst other things. So just some quick testimonial, I'll try to be really brief. We've worked with many patients who weren't candidate for surgery due to obesity, or we've had people that had uncontrolled diabetes and smoking. Some of our clients have lost up to 40 pounds in 4 months, 20 pounds in just several months, quit smoking, been able to go through the surgical process. So at the Bone and Joint Health Network, we have 2 navigators, the lovely Jessica, the inpatient, and then me, outpatient. I assist, as I said before, patients before surgery, or sometimes to even postpone, or some people just don't want surgery and they just want to deal with the chronic issues. So let me give you a really brief history of navigation. It started in oncology to support people through their most complex emotional needs when they got a cancer diagnosis. It has now been kind of spreading out, and it's in primary and community clinics, and it's becoming a part of hospital culture as well. It supports patients through their most challenging moments or through their long battles with illness, and we aim to be there through thick and thin every step of the way. Navigation can connect the dots. We work hard for our clients, we listen to their needs, we assist them with obtainable goals. We're armed with knowledge and empathy and resources, and we strive to support our clients. It's a personal service that brings the human connection back into people's lives while dealing with the complexities of their illnesses. Am I running out of time here, or? Yeah, so I'm just gonna, this is kind of what we do. We do a consult, and then it can either be phone or they come in one-to-one, and we listen to them, we offer them resources, we assist them with, we even can help people get partnership, insurance, transportation. We work with our partners, but we also work with just resources in the communities, nonprofits, anything that's gonna help the clients for whatever they need. Yeah, so these are some of our partners. We have 2 of them here. This is one of our acupuncturists, and this is Steve, who owns, well, this is Michael Johnston, one of our acupuncturists, and Steve Reis, who owns Santa Rosa Strength. We work with many physical therapists, some specialized physicians that work with, weight loss or sports medicine. We're just really trying to be integrative and really reach out to the community. So I'm going to hand this off to our acupuncturist, Michael Johnston, and he deals with chronic pain, and he'll tell you all about it.
Good morning. Really appreciate you guys having us over here today. This is a very, that last slide was a very interesting slide. And the reason is because it always hasn't been this way. There's been a large gap for patients, consumers, citizens to largely go on their own in terms of trying to find what therapies might be of benefit to them. I've been in practice for 16 years. I've practiced in a variety of venues, from a hospital in China. I worked there for 2 years in an inpatient clinic that was largely post-stroke related, in a pediatric clinic for 6 months, and with an herbalist for 6 months. So that was all there after completing my training in Santa Fe, New Mexico. So in practicing in these various environments, I've found that as far as acupuncture goes, pain management, pain relief is largely my favorite interest, because there's a quick benefit for people generally. If the therapy is of benefit to them, we'll know quickly. The reason I bring up that other slide is because probably the single most thing I've learned in dealing with patients with chronic pain is it requires a wide array of therapies. No one thing works for anybody, and something works for everybody. So really, in the past, it's been up to the patients to go out and find for themselves. A massage therapist, a chiropractor, an acupuncturist, a physical therapist, whatever. And they were largely guided by their primary care physicians that also had a limited scope of understanding of how these various other therapies could contribute to a patient's well-being. So the benefit of networks like this is huge, because now a patient can come in and be guided directly, like, oh, we've got this person over here and this person over here. They've been credentialed, we know them. And any one of us wants a referral about something that we know, from someone we know. So with arthritis, largely, 5,000 years in 7 minutes, The thing I can tell you that's most important about acupuncture and any inflammatory process is there's no real magical mystery with acupuncture. Really what it's about is promoting circulation. So use it or lose it, these kinds of ideas of movement, of creating circulation in the body, that's largely how acupuncture works. We get the word for arthritis in Chinese, we call bi. And what it translates to directly is painful stagnation. And so something's not moving as it should, whether it's blood or chemicals or hormones, all these various things in the body that can lead us to actual pain. Largely what acupuncture wants to do is just help, it's asking the body a series of questions. It's not really forcing the body into one thing or another. It's not stopping anything, it's not blocking anything, it's moving it. So we say we don't block pain, we unblock pain. And so this, in addition to all these other various things, physical therapy, exercise, diet, all of those can become mechanisms of either health or disease. So what I like about Chinese medicine is that it offers us, and it's appropriate to come to a meeting on section on aging, because this idea of anti-aging has become so popular in this country that there's only one way to anti-age. And most of us understand what that is. The idea in China is to age strongly. So that's what we like to promote. That's what networks like this promote. And if you ever have any questions, please feel free to call. I'd be happy to answer any questions, just as anybody else on that list would.
Hello, everybody. I've just been informed that I have about 5 minutes, and it was an 8-minute presentation, but I think I can do it in 5 because they've done a great job and they've covered some of the stuff.
Do you have a clicker?
She's got it. Forward. Point it this way?
There you go.
Okay. Well, this is our facility. I want to thank you for inviting me. It's a safe, clean, quiet, and uncrowded facility. We currently serve roughly 180 clientele of individuals, and we've been in business since 2001. Now, here we specialize in a unique brand of resistance training that's intended to maximize most of the benefits of exercise in just 2 weekly visits. We focus on core strengthening, balance, and stability training. We also treat for osteopenia, osteoporosis, osteoarthritis, and sarcopenia. We are comfortable working with pre and post hip and knee replacement. We also work with a lot of individuals being treated for chronic lower back pain. And we also are comfortable, we can accommodate wheelchairs as long as people can get in and out of their wheelchairs, and we can also accommodate individuals with walkers. And one of our specialties is having people that come in with walkers. After 6 months, they don't need their walkers or their canes anymore. So that's fairly rewarding. So that's the facility. Most of our work is based on science, and I say most of our work because some of the psychology behind motivating people defies science. I'm realizing that needs to be centered, but we specialize in treating sarcopenia. And if you're not familiar with the word sarcopenia, it's the gradual loss of muscle as one ages. And they think it is the leading cause is why people end up in the disability zone, simply because they're losing muscle as they age. And when you lose a muscle, you lose all the support metabolism that goes along with it. We talked about baby boomers in the Wall Street Journal last week. They say 10,000 people a day are turning 65. So there's a lot of people who are going to be needing these resources as they get older. And they're suggesting that by the time you're 80, you will have lost up to 50% of your lean tissue. We have some fun little sayings around our facility. One of them is strength train or die a slow, miserable death. And if you think we're kidding, you should just try it. This is from the biomarkers, a book published about 15 years ago. But people typically get to 65 and then they spend 65, 70, 75, 80, they spend the next 12 to 15 years slowly declining into various states of disability. But with a program like ours, with the strength training, we bring back the muscle and we postpone injury just disability zone. And the other saying that the weaker your thigh, the sooner you die.
Oh my God.
Because you can put it on the internet and you'll find that thigh circumference and weak thighs are associated with higher all-cause mortalities, and they're just thinking it's because you're not able to get up and move, and it's a slippery slope.
Unless you have chicken legs already.
Unless you have chicken legs already. So I went back, I had to do a little bit of homework. This is stuff you already know, you guys already talked about it. Osteoarthritis is a big problem, and osteoarthritis is typically what leads to these joint replacements. I've saved these, you can't see the year, that's 2002, 2001. I've saved them just for today. I've never got to use these before. They're 15 years old. So it's a coming epidemic. More and more people are getting their hips done. And the craziest statistic is it's younger and younger people are getting hips done now. The technology is getting better, but still, you get a hip replacement when you're 45, 50, you're more than likely going to wear that thing out. You're going to have to go for a second surgery. So the rehabilitation and the strengthening of the muscles become more and more important. There's a knee replacement. You guys all have seen this stuff before. Knee osteoarthritis is the primary cause of dependency in older adults, and it's the primary reason that people get knee replacements. Now, how can we help? It's through resistance training. You just type in resistance training into Google, and it's like, well, it's a panacea. It does everything. It doesn't do everything, but it certainly helps make your life a whole lot easier. Because if you can stop losing muscle as you get older, it's a good idea. Resistance training is shown to reduce arthritis pain by 43%. It's the most effective exercise for improving your strength, improves function, balance, and strength in older individuals with total knees and osteoarthritis. And they found for some people in some studies that resistance training works better than some medications. Pre-op, we can help people lose weight, gain muscle, strengthen the entire body, strengthen the muscles surrounding the joints in question. You might not be a candidate for surgery because your bones are too soft. So the strength exercise is proving to be one of the safest, most effective ways to strengthen bone. Post-op, for hip and knee, the strength exercise makes outcomes all a lot better with the strength exercise. Lower back pain, we all know the stats. Lower back pain is terrible. Most of us live with it. I've got a little chronic low back pain myself. But we have equipment especially designed to isolate and strengthen the muscles of the lower back. The process, people come in for a consultation. We do a fitness evaluation or a short performance physical battery, depending upon the condition that you're in. We map out, it's kind of a biointervention plan. We want to age more strongly, so we map out a plan how to do that. We introduce you to the resistance training, and then people do go through quarterly reevaluations and assessments, and I think that is it. So if you're interested in making life easier and more enjoyable for the people, for you, or the people that you serve, we feel that by engaging in a resistance training program, you're laying a pretty good foundation to avoiding that slippery slope into disability. And it's also good, it slows the cognitive decline. I didn't put that slide in here because we're bone and joint health and spine, but they're finding that the resistance training stimulates higher executive function of the brain, which slows cognitive decline. Thank you.
Do you have any questions for the panel?
Just one question. There's an article today, there's been a lot of talk about the use of opioids and overuse. Could someone speak on the alternatives to that, or?
That's why we work with acupuncturists, we work with many masseuses, and even strength training. So a lot of people are prescribed opiates, and that's not my judgment it's the physician that prescribed it, but some people don't want to be on such a regimen of pain meds, and it's affecting their lives. So we do try to help them work through a lot of issues with, using our acupuncturists or aquatic programs like the one here at the Finley Center, or some different heat technologies and things like that. So we try.
Any other questions? Okay, Tony's first way in the back here.
I'm curious,
that was in here, and since I hustled through, we always like to say that. Oh, I'm sorry. We always like to say that we're not doctors and we don't play doctors on TV. We leave that to the experts. So unfortunately, right now we don't have a physical therapist on staff, so it is mostly private pay at our facility, and people on average pay anywhere from, it's $150 a month for the services. Every time an individual comes in, they're guided through their workout. There's nobody left to themselves when they come into our facility. And we're probably going to work out some sort of a discount for the network.
Michael, do you do outside this? Are you in private practice, and what forms of payment do you take?
Yes, yeah, I am in private practice. I was approached by Janelle a few months ago to join the Bone and Health Care Network, very happily for me. And I take all insurances. Medicare, unfortunately, does not cover acupuncture. I think they reimburse about $8, and I don't even know how to sign up with them, to be honest. But I know I'm in network with Blue Cross Blue Shield, Anthem, United Healthcare, HealthNet, Cigna, Aetna. So, and yeah.
Medi-Cal does.
I'm sorry.
Medi-Cal pays for acupuncture.
Yep, partnership does.
Okay, there you go. All right, I did not know that.
Someone asked, what's the private pay rate for acupuncture?
For me?
Yes.
My initial visit is 75 and follow-ups are 50.
I had a question. You said that younger and younger people were needing these hip and joint replacements, and if you could just address why that is.
Some of it, they think, is in relation to the people being overweight, the obesity epidemic, and then there's also another subgroup of young people who were athletic when they were younger, and now they're coming to terms with their repetitive overuse injuries.
Inflammation in the diet as well.
Sorry, inflammatory diet, standard diet doesn't help.
Inflammatory diets.
What's that?
So if you eat, someone in the back said that if you eat foods that make you become inflamed, that can contribute.
I want to make a comment here. I'm 81, and I was told I needed a knee replacement. The pain was bad, and I also had tendonitis in the Achilles heel. I went into physical therapy. That helped, and then I joined their gym. They charged me $40 a month to come in, and it's like having a trainer. And this is over a year I've been doing this training. I have no pain, I walk around.
Testimony.
That's fabulous.
What a testimony. Anybody else? Any questions? Any more questions? Yes.
So I know that so many of the extra services that are needed to have whole health are not paid for by our insurances. In Washington State, the insurances cover naturopathy, they cover several things that keep people healthy. Do you guys have any clue what we can do to get the talk of the people out there? Because we need these services to be paid for by our expensive insurance. Any thoughts on that?
That's a great question. Oh, Mike has some comments. Do you all have comments? Well, you have a mic up there, so.
Yeah.
Okay.
So, I mean, there are a lot of insurance that will, they'll pay for chiropractor, acupuncturist. Partnership actually does, some of that acupuncturist will take partnership. It's a lot of paperwork, but they will do it. And then a lot of people will offer sliding scales services for our lower income, because some of these services are really expensive and we're aware of that, and many of St. Joseph's clients are low income. So we really have to try to work with different people in the community and try to get them rates that they can afford. So. Yeah, that's true. We should really rally towards that.
There are two ways a person can have their Medicare. Original Medicare does not cover those kinds of things, but if a person chooses to have their Medicare through an Advantage plan, which is a group of managed care companies that have contracted with Medicare, they can provide over and above what Medicare does, and you'll see some of those Advantage plans covering chiropractic, covering acupuncture, covering some of those other things that a person on original Medicare would not have. So that is an options question.
Okay, we have one more question, and then we got to wrap it up because normally we're done at 10:30. I was just going to add to that, hopefully be helpful, is chiropractic care and acupuncture more than likely can be paid for if it falls under the medically necessary acute care chronic pain. So if you speak to these individuals, I imagine they could use diagnostic codes that refer to those, and most of us fit into that, and that's the best way we can fit into the medical model.
Well, let's have a big round of applause for this